Hey, I'm Gabe, and I will be your radiographer today, and I will be assisting the radiologist on your esophagram today. Can I get your name and date of birth? Is there any chance you could be pregnant? All right. Before I ask you the rest of the prep questions, I'm going to need you to change into this gown and remove everything, including any body piercing or artifact that you may have. Have you had trouble swallowing? Have you had any chest pain, indigestion, vomiting that you cannot explain, any cancer, any surgeries around your esophagus area, high blood pressure? Did you eat, chew gum, or smoke before this procedure? About 8 to 9 hours before? Did you eat anything after midnight last night? All right. First, we're going to start the exam with you standing to take some spot images so the radiologist can evaluate you normal swallowing, this contrast that he needs you to drink. Doctor is going to have you swallow some carbon dioxide crystals, thick barium and thin barium. I'm going to give you the cup that contains the carbon dioxide crystals mixed with a small amount of water to drink, and it's kind of like an Alka-Seltzer, kind of like throwing some pop rocks into some water. And as soon as I open the crystals, I'm going to dump them in the cup with the water. I'm going to swirl it twice and give it to you to drink. Don't look or stare at it or anything. Just go ahead and throw it back and drink it. You may feel like you need to burp, but please don't do that, or we're going to have to start the procedure all over. After that, I'm going to give you the thick barium to drink, and it's like a chalky milkshake, and it is fairly bitter, but most patients do tolerate it well, and I had to taste it, and it wasn't terrible. I'll say that. It wasn't that bad for real. Then I'm going to give you the thin barium to drink, and it's less dense than the thick, but does have that similar taste and texture as the thick, but it's not bad as well. After that, I'll give you a washcloth or paper towels to wipe your mouth with, and you're going to take the cups and drink it on request of the radiologist. The radiologist may have you take a barium tablet, which is just barium in pill form. And the radiologist will ask you to swallow several mouthfuls so that the act of swallowing can be observed to determine, what's wrong with you or anything. The radiologist will tell you to move into different positions on the table to see how the contrast reacts with your esophagus. And when the radiologist is done with the fluoro part, I'm going to take our other x-ray machine and take some more images of your esophagus. Do you have any questions? All right, now that the procedure is done, I'm going to need you to increase your fluid intake. Drink plenty of water. It's normal to experience white stool, and it should take about 24 hours for the barium to leave your system. And you're going to want to take a laxative if you become constipated or struggle going to the bathroom or haven't had a bowel movement in 48 hours. And call the doctor if anything unusual occurs.